So Daratumumab is really a first-in-class CD38 monoclonal antibody. CD38 is expressed on a variety of tissue types, including plasma cells, but also lymphoid cells, myeloid cells, epithelial cells, nerve cells, and striated muscle cells. So it's broadly expressed, and yet because of the fact that it's ubiquitously expressed on plasma cells, there's been interest in CD38 as a potential target in multiple myeloma. Recognizing the fact that it is present on a number of other cell types as well, the study, of course, had to proceed cautiously as a first-in-human approach, and the initial dose was 0.005 milligram per kilogram, with dose escalation to 24 milligram per kilogram in the first part of the study, which was essentially a dose-finding study. That part of the study has been concluded, and we're now into part 2 of this study in collaboration with some wonderful colleagues in Europe who have been obviously instrumental in developing the drug, along with the manufacturer Genmab. The responses, which have been reported at last year's ASH meeting and then again at this year's ASCO meeting, have been quite impressive. In that at doses 4 milligram per kilogram or higher, the overall response rate, including minimal response, was over 60%, and the rate of partial response or better, 50% reduction in the monoclonal protein, is on the order of 40 to 45%. In addition to that, the drug has been well tolerated, which we are very, very pleased to see, of course. There have been infusional reactions, which are not uncommon with monoclonal antibodies, and chief among them, bronchospasm was observed as an infusion-related reaction early on in the clinical trial, but with appropriate use of supportive medications and pre-medications, namely corticosteroid, with treatment of additional patients as part of this clinical trial, we've observed that the overall toxicity profile seems to be pretty good. So now there's tremendous interest in looking at Daratumumab not only as a single agent, as has been done thus far in a very heavily pretreated group of patients. The median prior numbers, lines of therapy in the initial experience with Daratumumab was 5, meaning that these patients had received a lot of prior therapy. Now there's interest in looking at Daratumumab in combination with other drugs, and at this meeting, Torben Plesner is presenting data on the initial experience of Daratumumab in combination with lenalidomide.